Allied health professionals in Gibraltar say they've had enough. Today they've organised a demonstration. They're walking to number 6, calling for fairer pay. They say they've been undervalued for a very long time.
We submitted our pay claim based on the parity agreement from the 1970s. What we've found is, and we've done an extensive study, that many of our allied health professionals are way below the parity rates that exist in the UK. So if you compare allied health professionals in Gibraltar compared to those in the NHS in England specifically, which is the lowest across all of the UK, they fall below their pay. And what we're asking for is honour the parity agreement and respect the fair wage for all of our allied health professionals.
I mean, there's also the obvious, the disparity, they're getting less money, but how does this impact the job itself?
It impacts it heavily because when you think first and foremost recruitment. So we're having to recruit people from the UK, but many people don't apply, so it's not lucrative. It's not something very appealing for members, highly qualified members of staff from the UK to apply for Gibraltar, because who's going to take a pay cut to come to Gibraltar, especially with how expensive it is to rent, etc.
Physiotherapists, radiographers, pharmacists and other key health workers, they're claiming that they're being paid thousands of pounds less than their colleagues in the UK for doing exactly the same job.
I'm the physiotherapy manager.
And why are you here today?
Because our staff are below parity compared to the UK, and therefore it's making it difficult to attract staff over and retain them.
We're one of the only AHPs that we don't get this equal payment compared to everybody who works in the GHA.
We have a terrible problem with recruiting, and as you know, the price of rent and the standard of living is very high here, but it's very costly, and it has a difficulty in recruiting and sustaining kind of our workforce.
One thing that's being forgotten is about patient safety. Yeah? So, you know, that's very important, that's been left out.
What do you want? What do you want? Exactly, right?
And while demonstrators chanted outside, the Minister for Health and Care, Gemma Vasquez, met with union representatives this evening.
I have to say I'm slightly surprised by the demonstration. We held a meeting in my office on Tuesday, so 2 days ago, where they were told that the government was committed to the principle of parity and that they needed to check the numbers. So we committed to, if there was differentials in parity between any grades, we committed to looking into it and addressing it. And indeed, we committed to backdating the claim to the 1st of April 2025. There were further claims that were presented, which we said that we would park and present differently. But the claim on parity, given the government's commitment on parity, we did commit to looking into it. So I'm somewhat surprised at the demonstration today.
Just gone in, we've had the discussion with the Minister, with Fred Martin from Industrial Relations and the Ministry PA, together with your allied health professional shop stewards. And there's been a bit of a back and forth in the discussions, but essentially they agree with the principle of parity, and they're going to be writing to us back with a time frame in relation to that.
The government says it's committed to parity and that it will be writing to the union in the coming days. Unite, for its part, says this is just the beginning, and if the government doesn't come to the table, further action could be on the way.